Thanks, Dave. Mississippi is dead last in the United States when it comes to the number of doctors available for patients. Advanced medical technology and other innovations are bridging that gap. But as Jewel Hillary explains in this special report, the reality often means you will wait months before you see certain doctors.
16-year-old Michaela Whitfield and her mother, Caroline Brown, are nearly inseparable.
I can't go to the mall by myself. I can't go to parties or anything. My mom has to be everywhere.
When Michaela was 10, she suffered her first seizure. Since then, her health has not improved.
She falls out every day. She falls out, have a seizure every day.
A doctor recently diagnosed Michaela with postural tachycardia syndrome. That causes Michaela to faint. Physicians haven't been able to pinpoint exactly what's causing Michaela's seizures.
Sometimes you can feel it, and sometimes it's just out of nowhere.
Dr. Timothy Quinn with Quinn Healthcare has referred Michaela to numerous specialists, but the wait to see them often takes months.
In a lot of cases, appointments are almost impossible, and sometimes we have to even send patients out of state.
Michaela was referred to a neurologist January 14th, but the earliest appointment was more than 60 days later.
In the case where she's waiting to go to the specialist, all we can do is just keep running to the ER.
According to the Association of American Medical Colleges, the national average is more than 260 active physicians per 100,000 people, ranging from a high of more than 421 in Massachusetts to a low of about 180 in Mississippi. Dr. John Mitchell is the director of the Office of Mississippi Physician Workforce. Mitchell says neurology, psychiatry, and dermatology are some identified specialty needs in the state. Thankfully, there's a new program at the University of Mississippi Medical Center to train dermatologists. Dr. Mitchell says they're working to educate, retain, and attract more physicians.
If we can get people into Mississippi and they actually see that we're much more opportunities there than anticipated by the general public, then we usually keep those physicians.
Dr. Claude Brunson, the president-elect of the Mississippi State Medical Association, believes UMMC's new up-and-coming medical school building will increase the chances to retain more doctors.
At the medical school, we're expanding the class size so that we can increase the total number of graduates.
The medical community is using advanced technology to close Mississippi's doctor shortage gap. It's called telemedicine and allows doctors to see patients over the internet. The technology is so high-tech that doctors in Jackson can use a Bluetooth stethoscope to monitor the heartbeat of a patient who's hundreds of miles away. Telemedicine is available in 46 counties.
Let me listen to her heartbeat and lungs. That'd be great.
Dr. Christy Henderson is the Chief Telehealth and Innovation Officer at the University of Mississippi Medical Center and says telemedicine could benefit patients like Michaela. For instance, a Mississippi licensed specialist out of state could assess Michaela via telemedicine and give the family answers they need to find a solution. Henderson says telemedicine also helps doctors see more patients efficiently.
So it increases their capacity, so then it hopefully will shorten that distance between the time that somebody can get a clinic appointment with them.
Closing the wait time to see a specialist and cure for Michaela is at the top of her mother's wish list.
If we had more, I think the appointments would be closer. Within a week, maybe. I'm pushing it within a week.
Reporting for WLBT News, I'm Jewel Hillary.
Dr. Mitchell says as more specialties are identified and needed, he hopes to help expand and create programs to train those physicians in Mississippi.